Today, I will be presenting a training proposal for Regis Garden Aged Care Company's existing health and safety training module. My name is Casey McKinay, and I am currently doing MBA MHRM at Murdoch University. For our introduction, Regent's Garden is an aged care provider with 5 locations in Western Australia, situated in Scarborough, Joondalup, Burragoon, Bateman, and Ubin Grove. It is estimated to have an employee of around 700 across all branches. Regent's Garden also offers a range of services in the aged care industry. They prioritize the well being and quality of life of their residents and strive to provide high quality care. Their services include assisted living, dementia care, respite care, and palliative care. They aim to create a safe and nurturing environment for their residents while promoting a culture of safety and well being for their employees. Regent's Garden Aged Care Facility recognizes the critical role of work health and safety in ensuring the well being of both residents and staff. Aged care facilities are unique environments with potential risks and hazards related to resident care, manual handling, infection control, and also emergency response. Consequently, it is also crucial to provide specialized training that equips staff with necessary knowledge and skills to minimize risk, maintain a safe environment, and provide quality care. For our scope and objective, the training program will cover all staff members at Regent's Garden Aged Care Facility. This will include the nurses, the care staffs, the kitchen staff, housekeeping, maintenance personnel, and of course the administrators. The training will encompass key areas such as manual handling techniques, infection control practices, safe medication administration, resident safety awareness, and emergency response procedures. The program will be conducted through a combination of in person sessions, e learning modules, and practical exercises to ensure optimal learning outcomes and skill development. For our objectives, we aim to increase awareness. The primary objective of WHS training program is to increase awareness among staff regarding potential risks and hazards in the workplace. The training should cover topics such as infection control practices, correct manual handling techniques, resident safety awareness, first aid and emergency response, and chemical safety to ensure that staff has the necessary knowledge and skills to identify, assess, and control workplace hazards. Next would be is to enhance skills. So this is a practical and technical skills of staff that are required for maintaining a safe and healthy work environment. Thus, training should be interactive and practical, including demonstrations and exercises designed to reinforce learning and help staff to apply their skills correctly in the workplace. Next would be to aim on fostering teamwork. Another objective of WHS training is to encourage a culture of teamwork, right? So, where staff members work together to ensure compliance with WHS standards. So, the training should emphasize the importance of communication, reporting incidents, and taking corrective actions, in addition to providing staff with the necessary skills and knowledge, of course. And then we also aim to reduce workplace incidents. So the primary goal of WHS training program should be to reduce workplace incidents, injuries, and illnesses. So this can be achieved by increasing staff awareness, enhancing skills, and fostering a culture of safety. By implementing safe working practices, staff can reduce the risk of accidents and incidents in the workplace, isn't it? And lastly is to ensure the compliance. Work HS training program should aim to ensure that staff members have a clear understanding of their responsibilities and commitments to comply with all relevant regulations and guidelines. So by ensuring compliance, Facilities can reduce risks and liability associated with noncompliance and provide a safe environment for residents and, of course, for the staffs. So, by setting these objectives for a WHS training program, the facility can ensure that staff members have the necessary knowledge, skills, and behaviors to fulfill their responsibilities and obligations regarding work health and safety in the workplace. So, upon analyzing the current WHS practices at Regent's Garden Aged Care Facility, several areas for improvement have been identified. So, staff members lack consistent understanding of work health and safety protocols and may not be aware of the specific risks associated with working in an aged care environment. Additionally, there may be inadequate knowledge concerning proper handling techniques, infection control procedures, and emergency response protocols, which could result in accidents, illnesses, and compromised resident safety. So, for the issue, the primary issue at Regent's Garden Aged Care Facility is that there is a need for enhanced WHS practices to ensure the safety and well-being of both staffs and residents. Inadequate work health and safety knowledge and inconsistent adherence to protocols increase the risk of workplace accidents, injuries, and the transmission of infections, of course. These pose a threat to health and quality of care provided to the residents. Insufficient training has the potential to decrease staff morale, increase absenteeism, and negatively impact the facility's reputation. So, for the methodology used in this proposal, first we identify that the training needs assessment. So, by conducting a thorough training needs assessment to identify the specific work health and safety training requirements at the facility. Next is content development. Based on the training needs assessment, develop comprehensive training content that covers key areas such as manual handling techniques, infection control practices, safe medication administration, resident safety awareness, and emergency response procedures. Another would be the training delivery. So we have to implement a blended learning approach, including a combination of in-person sessions, e-learning modules because of the current practices now, and practical exercises. In-person sessions will allow for interactive discussions, case studies, and group activities. Next would be qualified trainers and facilitators. So this is to engage qualified trainers and facilitators with expertise in work health and safety and experience in aged care industry. Next would training implementation plan. Develop a detailed training implementation plan including schedules, venues, and necessary resources. Next would be the assessment and evaluation. Implement assessments and evaluations to measure training effectiveness and identify areas for improvement. And then, of course, ongoing support and refresher training. It should be continuous. So, to provide ongoing support and refresher training to reinforce knowledge and ensure the sustainability of work health and safety practices. And then, lastly, it should be a continuous improvement. Continuously evaluate the training programs, effective, and gather feedback from staff and residents to identify areas for improvement. So by following this methodology, Regent's Garden can implement a comprehensive and effective work health and safety training program that would address the specific needs and challenges of the aged care environment. So hopefully this methodology ensures the staff members receive the necessary knowledge and skills to prioritize safety, mitigate risks, and provide high quality care to residents. So in conclusion, this training proposal aims to address the identified issues and improve work health and safety practices at Regent's Garden Aged Care Facility by implementing a comprehensive training program that covers crucial areas such as manual handling, infection control, medication management, resident safety, and emergency response. The facility can enhance staff members' knowledge and skills. So, this will contribute to a safer work environment, reduce the risk of accidents and infections, enhance resident care, and ultimately lead to a positive impact on the overall well being and reputation of the facility. Thank you.